Hello everyone, welcome to Vital Men 60, your YouTube channel dedicated to men's reproductive health. I'm Dr. James Edward Carter, a urologist with over 15 years of experience, currently practicing at Mayo Clinic and a member of the American Urological Association. Today, in our first video, we'll dive into a common yet often undiscussed issue, erectile dysfunction, or ED. The goal of this video is to help you understand what ED is, recognize its symptoms, and appreciate why it's a critical health concern. If you have any questions, please feel free to leave them in the comments below. Be sure to follow along for the next videos to gain a comprehensive understanding of this topic. Today, we're exploring erectile dysfunction, commonly known as ED, a prevalent health issue that's rarely discussed openly. Understanding ED not only empowers men to improve their quality of life, but also helps identify serious underlying health conditions early. Let's start with a striking statistic. According to the Massachusetts Male Aging Study, MMAS, by Feldman et al., published in the Journal of Urology, 1994, Vol. 151, pp. 5461, approximately 52% of men aged 40 to 70 in the United States experience ED to some degree. For men over 60, this figure is even more significant. So, what exactly is ED, and why does it matter? Let's find out. Erectile dysfunction is defined as the inability to achieve or maintain an erection sufficient for satisfactory sexual performance, despite having sexual desire. To understand this better, let's look at the physiology of an erection. When a man is sexually aroused, the brain sends signals through the nervous system to the penis. Blood vessels in the penis, particularly in the corpora cavernosa, sponge-like structures, dilate, allowing blood to flow in. As these structures fill with blood, the penis becomes erect. Muscles at the base of the penis then contract to trap the blood, maintaining the erection. If any part of this process is disrupted, for example, if blood vessels don't dilate properly, nerves are damaged, or muscles fail to retain blood, ED can occur. ED is classified into 3 levels of severity: mild, moderate, and severe. In mild cases, you might occasionally struggle to achieve or maintain an erection. Moderate ED involves more frequent difficulties, while severe ED means an almost complete inability to achieve an erection. Regardless of the severity, ED is a treatable condition, and it's crucial not to feel ashamed or discouraged. How common is ED? Let's examine some robust data from reputable studies. The Massachusetts Male Aging Study, MMAS, conducted on 1,290 men in the Boston area from 1987-1989, found that 40% of men aged 60-69 experience ED to some extent. Feldman et al., Journal of Urology, 1994, Vol. 151, pp. 5461. More recent data from the National Health and Sexuality Survey, NHSS, by Bacon et al., published in the Annals of Internal Medicine, 2006, Vol. 144, pp. 427-435, reported that 48% of men aged 65-74 and 52.2% of men over 75 experience ED, based on a survey of 3,005 American men from 2001-2002. These numbers highlight the widespread nature of ED in older age groups. Additionally, the MMAS provides insight into the incidence of ED, new cases that develop over time. For men aged 60 to 69, the study reported an incidence rate of 46.4 new cases per 1,000 men per year, or roughly 4.6% annually, Johannes et al., Journal of Urology, 2000, Vol. 163, pp. 460-463. This means that each year, nearly 5 out of every 100 men in this age group may develop ED for the first time. Why does ED matter? Beyond its impact on sexual health and personal well-being, ED can signal serious underlying conditions. A pivotal study by Thompson et al., published in Circulation, 2005, Vol. 112, pp. 3378 3385, conducted on 9,457 men from 1994-2003 as part of the prostate cancer prevention trial, found that men with ED have a 40% higher risk of cardiovascular disease compared to those without ED. The small blood vessels in the penis are highly sensitive to circulatory issues, making ED an early warning sign of heart disease. Moreover, ED is closely linked to other conditions. According to Selvin et al., published in the American Journal of Medicine, 2007, Vol. 120, pp. 151-157. Approximately 75% of men with type 2 diabetes experience ED to some degree, based on data from the National Health and Nutrition Examination Survey, NHNES, from 2001-2002, with a 455 male participants. Diabetes damages nerves and blood vessels, impairing erectile function. Similarly, a study by Giuliano et al., published in the Journal of Urology, 2004, Vol. 171, pp. 2341-2345, involving 2,026 men in France from 1999-2001, found that 30 to 40% of men with hypertension are at higher risk of ED. The good news? ED is treatable. From lifestyle changes like regular exercise and a healthy diet, to medical interventions such as oral medications or assistive devices. There are numerous ways to address it. Most importantly, don't hesitate to seek help. Over half of men over 60 experience this, and you're not alone. Symptoms of erectile dysfunction. Now, let's explore the symptoms of ED, the signs your body and mind may show when dealing with this condition. Recognizing these symptoms early is crucial, not only to understand the issue, but also as a first step toward finding solutions and protecting your overall health. Let's dive in. What are symptoms? And why do they matter? Symptoms are signals your body sends to indicate something isn't right. With erectile dysfunction, symptoms can vary widely, ranging from physical changes to psychological impacts. Understanding these signs is vital because they help you identify ED and may also alert you to more serious health issues, such as heart disease or diabetes. So, what are the specific symptoms of ED? We'll break them down into two main categories: physical and psychological. Physical symptoms of ED first. Let's discuss the physical symptoms, those directly related to the body. The most obvious and common symptom of ED is difficulty achieving or maintaining an erection. This can manifest in several ways. Inability to achieve an erection despite sexual stimulation. You may feel desire, but the penis doesn't respond as expected. Erections that don't last long enough. The penis may become erect, but loses firmness too quickly, preventing satisfactory intercourse. Erections that aren't firm enough. Even if an erection occurs, it may lack the rigidity needed for comfortable sexual activity. Additionally, ED may be accompanied by other physical signs, such as reduced sexual desire. You might feel less interested in intimacy, sometimes due to hormonal imbalances or other health issues. Difficulty with ejaculation. Some men experience issues like premature ejaculation, delayed ejaculation, or an inability to ejaculate. Pain during erection. Though rare, some may feel discomfort or pain when the penis is erect, possibly due to inflammation or structural issues. These symptoms can occur individually or in combination, and their severity varies from person to person. For example, some men may only occasionally struggle, while others experience persistent issues. Psychological symptoms of ED doesn't just affect the body, it can profoundly impact your mental well-being. Common psychological symptoms include anxiety and stress. Failing to achieve an erection can lead to worry about your performance. This anxiety can worsen ED, creating a vicious cycle. Low self-esteem and embarrassment. Many men feel less confident or even ashamed with their partner, leading them to avoid intimate situations. Depression. If ED persists without resolution, it can lead to feelings of sadness, hopelessness, or loss of interest in life. Relationship strain. ED can cause misunderstandings or conflicts with a partner, affecting emotional closeness and overall happiness. These psychological effects not only make ED more distressing, but also impact your mental health and quality of life. It's crucial to understand that ED isn't your fault. It's a common health issue with solutions. ED as a warning sign for bigger health issues. One critical point is that ED isn't just a sexual problem. It can signal more serious underlying conditions. For example, cardiovascular disease. The blood vessels in the penis are highly sensitive to circulatory issues. ED may be an early sign of heart disease or atherosclerosis. Diabetes. ED is common in men with diabetes, especially type 2, due to nerve and blood vessel damage. Hormonal imbalances. Low testosterone or other hormonal issues can contribute to ED. Other conditions. High blood pressure, high cholesterol, or neurological disorders may also be underlying causes. If you notice persistent ED symptoms, don't delay. Consult a doctor. A comprehensive health check can uncover underlying issues and provide appropriate solutions. Seek help and find solutions. ED is common, and the great news is it's treatable. Don't feel embarrassed or think it's something men shouldn't talk about. Doctors are here to help without judgment. Early intervention can improve your sexual health and protect your overall well-being. You might need lifestyle changes, medications, or treatment for underlying conditions. All are viable options. In summary, we've explored the symptoms of erectile dysfunction, including physical signs like difficulty achieving an erection or reduced libido, and psychological effects like anxiety and low self-esteem. We've also seen that ED can signal larger health issues, making early recognition and medical consultation critical. If you're experiencing these signs, know that you're not alone, and there are ways to improve. In the next section, we'll dive into the causes of ED and how they affect your body. Stay tuned to learn more. The importance of understanding ED. You might think ED is just a minor issue, but in reality, it can profoundly impact your life and even signal more serious health problems. Let's explore why understanding ED is so crucial. Why understanding ED matters. ED isn't just about sexual health. It's a key part of your overall well-being. Knowing about ED helps you recognize that it's not something to be ashamed of or hidden. Instead, it's a treatable medical condition that may point to other health issues. Here are 4 key reasons why understanding ED is vital. 1. Impact on quality of life. ED doesn't just affect your ability to have sex. It can lead to significant psychological challenges. Imagine feeling self-conscious, anxious, or even depressed because you can't perform as expected. Many men feel inadequate, which can strain their relationship with their partner. You might start avoiding intimacy, creating distance in your relationship. This isn't just your issue, it affects those you care about. Understanding ED helps you see that you're not alone and that many others face the same challenges. By grasping the issue, you're more likely to seek help and communicate with your partner, reducing stress and boosting confidence. 2. ED as a warning sign. One of the most critical reasons to understand ED is its potential as an early indicator of serious health issues. Did you know that the blood vessels in the penis are highly sensitive to circulatory problems? This means ED can be the first sign of cardiovascular disease, high blood pressure, or diabetes. If you experience ED, your body might be signaling a deeper issue. For instance, if you have ED without an obvious cause, it's wise to check your cardiovascular health. Tests may reveal circulatory issues. Similarly, if you're at risk for diabetes, ED could be an early clue. Recognizing and addressing ED can help you detect and manage these conditions sooner. Protecting your health. 3. Treatability of ED. Many people don't realize that ED is highly treatable. Understanding available treatment options empowers you to seek help and improve your condition. There are numerous ways to address ED, from lifestyle changes to medical interventions. For example, you can start with regular exercise, a healthy diet, and stress reduction. These changes not only help with ED, but also benefit your overall health. If needed, consult a doctor about medications like Viagra or Cialis, or devices like vacuum pumps. The key is that you don't have to suffer in silence. Effective solutions are available. 4. Reducing stigma and encouraging dialogue. Finally, educate